Dr. Uma's podcast is a series of podcasts providing career advice, work-based tips and learning skills, helping you become a better doctor with a healthy work-life balance. These podcasts are in association with MRCPCH speciality courses, who specialise in courses in interview skills, application form writing and communication skills. Check it out on mrcpch specialitycourses.co.uk. Hi, welcome to another episode of my podcast. What I want to talk about in this episode is what advice would I give you if you were doing a spin rotation and were about to start that rotation. But before I go into how you can get the most out of it, the first thing I want to sort of put out there is that a common thing that a lot of people say to me who are either doing their spin rotation in the tertiary centre, halfway through it, or even afterwards, they feel really lost because they've gone in as an ST7, someone who is very confident, very competent, very good at their job as a general paediatrician. And then all of a sudden, they've walked into a specialism where they don't really know what's going on around them. The language being used, the expectation, the mood of the room. There's many ways people have described it to me. Is just out of their norm, out of their depth, and they never really feel like they're getting to grips with the job. And that's because they compare themselves to the people in the room. Yes, you are working with other registrars, and yes, you are a registrar, but as a paediatrician, you wouldn't compare yourself to a surgical trainee or as an adult physician. You're all very different and been trained very differently. Likewise, though you're all paediatricians, you, as the ST7 doing their spin, are a general paediatrician. And the other registrars they've had general paediatric training, but they have trained and they've been in their specialty for some time. So they are going to be different. So the first thing I would say, as you embark on this year, do not compare yourself to everyone else. The purpose of you being there is not to become them. It is to become a general paediatrician with a special interest which you can take in a DGH department and work both as a generalist and as someone who can manage common problems of that specialty. And it's because you're interested in that. So please, it is very normal. And it's a feeling that a lot of people find negative, that they just always feel like people are judging them. And I can tell you that no one is. People are aware that you've come with no prior experience. You're coming to achieve your spin curriculum items, and they're not expecting you to become an ST7 of your specialty. You're an ST7, but not of that specialty. And even if you were to compare yourself to, at least I should be as good as someone who's just started their training like I have. And that's also a wrong, way of thinking, because that person who is a new trainee in that specialty and who will be going down that road of that specialty has probably shown a massive amount of interest and has done a lot of rotations, may have done an SHO job, may have done out of program, who knows, but it would have done a lot. They've gone to a lot of courses, so they've done a lot of groundwork before they are starting this job. So already, regardless of the grade being similar, actually the experience is, vastly different. So don't compare yourself. And that's something I want to sort of get out of the way, because that is something that really upsets people. Now, you are going to start. What would I say to you? Think about what you want to achieve during this 12 months. And so you've got to go in with a game plan. Should you be achieving publications, posters, presentations and meetings? Probably not if you're going down a spin route. If you're interested in that, and that's something that you are interested in doing and being part of, that's not a problem. Of course, if that's something that you want to achieve, then that's fine. Do that. That shouldn't be your priority. Your priority is to learn about the common conditions of this system, the common presentations, the red flags, how to manage them, what sort of things commonly get seen in clinic, what gets seen in clinic, which is outpatients, and on the ward, and in A&E, and what are the sort of things that get transferred in as an emergency. Because that's what you're going to be facing. You're going to be dealing with those sort of patients when you are a consultant in your hospital, and you'll be asked to manage these patients more specifically, and have them in your clinic, or be the one on call to come in and see them, review them, and liaise with the tertiary centre. So that really should be your priority. And with that, you should get to terms with the investigations, how to interpret them, how to do them correctly. So knowing about the most rarest things, knowing how to perform very specific tests. For example, with me as a cardiologist, someone who's coming to do spin cardiology for a year, I wouldn't expect them to learn CT and MRI. I wouldn't even expect them to go into the cath lab, because they're never going to have to do that. But they should know how to interpret an ECG. They should be able to do an echocardiogram. They should be able to manage chest pain and palpitations and dizzy spells, because that's what comes into the DGH hospitals. They should be able to manage acute emergencies, whether it's a single ventricle or someone who's post-operative, who's been recently discharged. These are the things that they should be aware of. And so try to figure that out before you go in. Now, of course, yes, you're going to be assigned a supervisor who probably has or may well not have looked after spin trainees before. And what they have done is gone through the grid, the subspecialty training, and they've looked after trainees typically in that area. So they're very well versed in that. So they're going to rely on you, potentially, to tell them what they need to sign you off for and what you need to achieve. And so you should be aware. And that's when you've got to really do your homework. So before you're going to go into this rotation, that's you're not going to get told 2 weeks before that you're going to a tertiary centre. You've applied for this spin. You know it's going to happen. You've got your placement. This is the time you really need to start reading a textbook, watching videos, whether that be on YouTube or otherwise, getting familiar with review articles. And again, don't get bogged down with specific therapies, but start to develop general understanding of principles and management. And so that when you do go in, you do have that basic foundation of understanding, so that it's easy for you to make that transition and to start working on the rota. You may need to go and speak to someone who's done the spin rotation. You may need to speak to someone who's doing it elsewhere. Try to get an idea of what you're trying to achieve. And with that, have a look on the college website. What is the curriculum? What is it that you're going to be signed off for? Because ultimately, you can do publications and you can do research and you can take advantage of whatever opportunities there are. But at the end of the year, you're going to have to show evidences against the outcomes that you're supposed to achieve to be signed off for your spin curriculum. So it's really important that you do that. So, what you should try to achieve are those outcomes. And as I said, all the more specific things, probably not the best thing to do. The other thing to think about is, what else is it? And you'll notice as you're doing your year that pediatric departments may be lacking in. Are there initiatives that you can bring in? Is there a better way of developing the service in a DGH. These are the things that actually are going to help you get a consultant post, because you come in with those ideas. Those are the things you can talk about in your interview and try to, develop the service within the network. So while you're in your tertiary center, try to figure out where the problems are and how you could potentially fix them. And the last thing I want to talk about is make sure you get feedback. And I know that's the purpose of getting or having supervisor meetings, but we've all had supervisor meetings where our supervisor doesn't really do a lot with us. So they don't really know, and they rely on other people to tell them, or they rely on assessment, feedback, or 360s. But I think you're going to have to also take the lead on this. Try to find yourself someone, a mentor, that could be a very senior registrar who can, help you with your learning, advise you what you're probably going to want to learn or know, what's relevant and what's not. There could also be a junior consultant. There's usually someone within the department that has someone that looks like they want to teach you, or sort of is the educationist. I think that's the word I'm trying to get at. But usually we find mentors who are like us, so they don't have to be an educationist or have an interest in that. We just gel with certain people, and I think as you start your rotation, you'll come to realize who you do gel with, and no one's going to ever say no to you when you ask them a question or you want to learn something. Just ask the question. You'll be surprised. People start giving some really good teaching. When I was very junior in cardiology, I used to ask my group of registrars all the time what I didn't understand, and I learned a lot from my peers. So don't be afraid to do that. Don't be afraid to ask people, whether your imaging could be done better, or whatever sort of practical task that you're going to do within your specialist, and how you could improve, and whether they're willing to help you with that. You'll be very much surprised that, generally, just like pediatrics, most people are really friendly. So I think that's all I really want to say, when it comes to starting your rotation. Keep your objectives simple, relevant, and prepare beforehand. Don't just go in and say, now I'm going to learn about my specialism now that I've started my job. I think to get the most out of it, if you go in already having a relatively decent understanding, you'll do far much better. You'll adjust quicker and you'll feel more comfortable, especially during your on calls. But your seniors are there to support you. They're aware of your limitations, and so do the team around you. And so this idea that you have that you're not keeping up, you're not as good as everyone else, you're just beating yourself up. You need to stop doing that. Okay? You're going to do really well. You just enjoy it. The more you enjoy it, the more you'll get out of it. But with that, like I've been saying, make sure you keep your learning reasonable, realistic. Don't bite more than you can chew, and make sure you learn what you're supposed to. Anyway, I hope you found this very helpful, and thanks for listening.